Welcome to the Progeny RX Medication Administration video series. My name is Hannah. I'm a nurse at VFP Pharmacy, a Progeny RX pharmacy partner. In this video, we're going to discuss how to mix and use Menopur. Menopur is a room temperature medication. Once it's reconstituted, it does need to be injected immediately. Prior to the use of mixing this medication, wash your hands thoroughly with soap and water and make sure you're using a nice clean surface. Mixing the Menopur using a Q-cap, you'll need your vial of medication, sodium chloride, diluent, a Q-cap, and your syringe. If your syringe still has a needle attached, twist off. You won't be using this. Flip off the caps of your Menopur and sodium chloride. Alcohol wipe the tops of each vial. Then peel the paper backing off of the Q-cap, and holding it by its plastic lidding, you'll snap it right on top of the sodium chloride vial. Then you can throw the lidding away. Take your syringe and pull the plunger down to the 1 ml mark. Screw it on to the Q-cap. Inject that air into the sodium chloride. Turn the vial upside down, and it will almost push itself back out. You're going to pull back to the 1 ml mark. The sodium chloride vials contain 2 mLs. Pull the syringe and Q-cap off of the vial, holding onto the barrel of the syringe. And then take your Menopur vial and just snap the Q-cap on top of the Menopur vial. Press down on the plunger to expel the sodium chloride into the powder. Turn it around and draw it all back out. Unscrew the Q-cap and discard in a sharps container. You're then ready to attach your 1/2-inch needle for subcutaneous injection. Tap any air bubbles so that they rise up to the top, and push on the plunger gently until you see a droplet form, and you're ready for your subcutaneous injection. If mixing more than 1 vial of Menopur, you'll draw up your usual 1 ml of the sodium chloride, and then take your Menopur vial and just snap the Q-cap on top of the Menopur vial. Press down on the plunger to expel the sodium chloride into the powder. Turn it around and draw it all back out. And take that mixed solution that you've just created and inject into the second vial of Menopur. Now you have 2 vials of Menopur mixed in the same amount of sodium chloride. Unscrew the Q-cap and discard in a sharps container. You're then ready to attach your 1/2-inch needle for subcutaneous injection. Tap any air bubbles so that they rise up to the top, and push on the plunger gently until you see a droplet form, and you're ready for your subcutaneous injection. For subcutaneous injections, make sure you wash your hands with soap and water. The most common site is the abdomen, using the left, right, or below the belly button, staying approximately 1 to 2 inches away from the belly button. You can also use the back part of the upper arm or the outer aspect of the upper thigh. Alcohol wipe the area and allow to dry. The needle goes straight in at a 45 to 90 degree angle. To press the plunger until it's all injected. Pull the needle straight out and use gauze or tissue if there's any bleeding. The sharps container comes with a permanently sealable top. Open the lid. Without recapping the needle, dispose the cap and the needle into the sharps container. You can close the lid, but do not seal it until it's full. If you have any further questions regarding your medications or protocols, please call your doctor's office or the pharmacy where you received your medications.